I hope you can see the screen. So this is the first class that we are starting today, the writing subtest. So in total, we have 45 minutes time with the writing task. In this part, we have first 5 minutes is your reading time, and then you have 40 minutes time to complete the task is your writing time. There will be one profession specific task. There will be one profession specific task. So these are different types of letter one can expect. This referral, discharge, transfer, request, information, and education. So these are different types of letter we can have in our OET writing. Okay, the most common type of letter in the medicine is the referral, but we can also expect the discharge letter and also the transfer, right? And information and education is not quite familiar or not quite common letter in OET medicine, and it's more common in pharmacy. Anyhow, still we have to understand about them. So in total, you have 500 marks for writing, and the passing score for the candidates who are doing OET to get them registered in UK is 350 in this subtest, as like others. But if you are going to for USA, so we need 300 in writing, right? So this will be the passing score for you for UK and for Ireland as well. Okay. So moving on toward the marking criteria, that is the most important thing in writing. So first of all, there are 6 points. The first one is the purpose of writing. The second thing is your, we can say, content, that is selection of case notes. The third criteria is your organization and layout. Organization and layout is the third one. The fourth one is your conciseness and clarity. The fifth one is your genre and style. And sixth one is your language part, right? So these are 6 points on the basis of which your writing will be marked. So we'll discuss in detail about these 6 points before we can move on and discuss one case life in class. So to begin with, what we have in the purpose of writing. So in purpose of writing or the marking criteria, you have two things. First of all, who is recipient? Who is receiving these case notes, or in simple, to whom we are writing this letter. The second thing in the purpose is your issue, or why are we writing this letter, right? So these are two things that you have to see. The first one is the recipient, like to whom we are writing this letter, and second is why are we writing this letter, right? So this is what we call as purpose of writing. The second thing that is the content. In content is the, we have three different points: relevant, semi-relevant, and irrelevant, right? We have relevant, semi-relevant, and irrelevant information. So basically, according to that, to see how would we consider something as relevant, semi-relevant, and irrelevant. Again, it's related to your purpose of writing. So relevant with reference to recipient and issue. You have to select that. And similarly, irrelevant with reference to recipient and issue. Now, semi-relevant can be relevant to the recipient but not to the issue, or might be relevant in second degree but not in first degree. Right? Anyhow, the next point is the organization of the case notes. So, in organization of the case notes, we can see that we have first of all, you can say in simple word, it's where to write which thing, or prioritization. You have to prioritize the details as per the importance of the history. So again, you can see that this is also depending upon your purpose of writing, the recipient, receiver end, and the issue end. According to that information, a particular case notes, let's say, either it would be prioritized to be written above or it has to be written below, depend upon the case. It might be a vague explanation at the moment, but when we display the case, it would be easy for you to understand. But just understand the context we have in the organization and layout, like how would you write down the address part, and like you have to read the line or leave the line actually, and the commas and so on. These are the part of the layout. The next part is the conciseness and clarity. So in terms of conciseness and clarity, you can see that conciseness mean your summary skill. Conciseness mean your summary skill, like you have to summarize, and which details should be summarized. Less important detail should be summarized. And in the same criteria, let's say we can say that clarity is the flow of your ideas. So conciseness and clarity, we can see there we have to summarize the detail that is less important, and we have to have, like the connectivity between the ideas, like sequence of the information given in the case notes might not be the right sequence, but you have to organize as per importance. Number one. And second is use of cohesive devices such as consequently, therefore, in addition, and hence, and despite, and so on. So these are some of the cohesive devices that can help you to make it more coherent and more clear, right? So next criteria is conciseness and clarity that we discussed. The next to that one is genre and style. Basically, in genre and style, it's simple. We can say mode of communication. So we have two things: a tone. In OET writing, we must have polite tone, no matter what. Number one, and second thing is in that part is the, let's say we should have the technical language, and this is a formal conversation between two colleagues. Okay, and second is your transformation of the case notes. It's not important for you to use the same letter that has been written in the notes or same words. but it's rather to transform. You can say it's better to transform. Like the things you have to transform. Maybe if it's a tiredness, so you can transform it to lethargy, right? If it's you can say lethargy, you can transform it to lethargic, and so on. Similarly, abbreviations used is not being appreciated, such as full blood examination is preferred to be written in this form. Okay, so these are some of the things that you have to keep in your mind. The last part is the language part. So in language, we have tenses, we have sentences, and parts of speech. So basically, your letter will dictate you, like how would you write. Right now, we can summarize the things for you what we discussed. We discussed about the timing of the class. Sorry, letter is 45 minutes time and 5 minutes reading time, and we can say 40 minutes your writing time. Right. Total marks will be 500. The passing will be 350 for the doctors for UK. Right. And you have, yeah. More important thing is you will be given just 2 pages. There is no extra answer sheet should be given to you. You have to write down your letter with 2B grade pencil. It's important for you to understand. And you can see that we have different type of letters such as referral, we have discharge, we have transfer. Transfer is almost the same as referral. We have request letter, we have information, we have basically I would say education, and so on. So types of letter we discuss. We also discuss about the marking criteria, that is purpose of writing, which includes recipient and the issue. We discuss the selection of the relevant case notes. You have to select the relevant, and we discuss about the organization like sequencing, relevant sequence. We discuss about the conciseness. It means that 180 to 200 words, right? But not counting the words, you have to summarize the information. Genre is the media of communication that you use, and language again, the tenses, sentences, and so on. Been asked actually regarding the sequence. So I'm just trying to explain to make you understand what I mean by the sequence. For example, two example, we are writing a referral letter. There is the receiving recipient. We have the same recipient, right? But the issue, let's say, they have different issue. The diabetes mellitus, Cushing syndrome, right? So for the person who is suspected to have diabetes versus suspected diagnosis of Cushing, for both of them, how important would be the family history? Let's say if I am writing a letter to the specialist, let's say endocrinologist, I'm writing this letter in this way. I'm writing in the introduction to refer or thank you for seeing whatever I'm writing. Mr. X, whose features are suggestive of, let's say, diabetes mellitus for further management, right? So we can write it down. I'm writing to refer Mr. XYZ, whose features are suggestive of diabetes mellitus for further management. This is the introduction, or your reason of writing should be clear in the introduction. So in this case, we can write down, let's say, Mr. X, who has a positive family history of diabetes mellitus. You will write in full form, and okay, let's say weight loss of blah blah. So you can see that in this case, if I would be writing this thing, So family history of diabetes mellitus would be quite significant to be written in focus, like right after the introduction. But in case of Cushing syndrome, we might write down the family history over here. We should write it down somewhere down the grade. So this is the organization example. I hope it's clear to you now. You can see this letter. Whenever we have to write, we'll go first to the writing task. Read this writing task carefully, and you need to see that to whom we are writing this letter. So in this case, a recipient is emergency registrar. You can see. So put yourself in the shoes of emergency registrar. Like we are writing this letter to the emergency registrar now. Afterward, you have to see the last visit. So a frequently asked question: which date should be written up above? So this is considered to be today's date in this letter. On your exam day, either you will have the exam date. You can say at over here, last visit, or they do mention that assume today's date, right? We can write it down over here. So the most important part of this writing task will be the assessment. What we have the assessment, we have the differential diagnosis. So the first diagnosis is the acute wall myocardial infarction. The second DD is the acute pulmonary edema that we are suspecting both, like likely interior and the question mark mean suspected. And the third that is confirmed thing is the asthma or the worsening of asthma, right? We can say. So now with reference to that, we have to see the case notes. It's paramedic transfer. It means that we are transferring the patient. Now we can start it in the case note from top to bottom. You can see that the age is significant factor. Patient presented here with mild certain chest pain. So we have to see certain thing in our mind when we are selecting that we are writing this letter to the emergency registrar. Number second, we have DDs including AMI, including APO, including asthma. So one cardiac and one pulmonary condition, and this is a kind of transfer letter to the emergency registrar and to the emergency department. Now we can see with reference to that the history. This is the acute symptom anyhow. The patient is having exertional chest pain, important. He was also having asthma, important. Family history, important, negative. Smoker, socioeconomic details, yes. 5 days a week, 5 by 7 mean. Stress, yes, important. The medicine, okay, that's fine. He has been taking some medicine for that. At that time, there was no chest pain on examination. Normal ECG, no abnormality detected. Normal troponin level. You are suspecting at that time early stages of ischemic heart disease or is stress-related chest pain. The patient is not interested to change his alcohol intake. Then we have something in plan. You can say the serum lipids, exercise tests. After 1 week, we have a review. We can see there still having occasional chest pain, worsening of asthma. On the exercise test, we have ischemic changes present. Bilateral V is there, cholesterol increase, and we are suspecting ischemic heart disease or upper respiratory tract infection. In that regard, at that time, you had managed the patient with these medicine as per required basis, angini, and after 2 weeks, you called to see the patient again. Now we can see that patient is here again with the chest pain, continuous chest pain for the last week. Often forgets to take the medicine due to alcohol, ethanol. Asthma has worsened, affected medicine compliance, like alcohol dependence. You have done the importance of anti-asthma medication and the therapy for the ethanol. Now you can see this is the recent history, very important. Sudden crushing chest pain. Asthma is worsening since last visit. Engine is not effective, very audible wheeze. ECG lung heart finding is very important. And we are suspecting that the DDs we already written. And we can see this is the plan, right? So with reference to that, now we can see how would we write down the letter. Now we can see, let's say
On the top left corner, we can write down the date. For example, 1/6/11 on the left corner. Then we can leave one line and we can write down Dr. Jeremy Barnett, right? Then we have to write down emergency registrar. It's important. Then we have to write down Marlborough Hospital, whatever has been given. Lakes Road, Marlborough, right? So this is something you have. This is not a comma actually. In this approach, you have to write down the address format, right? So afterward, after like say this is the date on which we are writing this letter, name of the recipient, designation, hospital address, street or address, and so on. Okay. Afterward, let's say after you have write down this thing, leave one line, and then we can write down dear Dr. Barnett. Second name. Put comma, and then leaving one line, we can write down regarding patient name Mr. Alvin, John Alvin. Put comma, and his age, let's say 48 years. You can write it down, right? No comma, no full stop. Afterward, you can write down the introduction part. So we can write down the introduction in this way. Let's say, thank you for seeing Mr. Alvin, whose features are suggestive of, you can write in full form, I'm just writing AMI or APO again in full form, along with exacerbation of asthma, right? Thank you for seeing Ms. Alvin, whose features are suggestive of AMI or APO, along with exacerbation of asthma. Like say, you can just write it down. I am transferring this patient via ambulance for further or for let's say urgent admission. If you will not write down this thing over here, it can be written in the conclusion part. So we can just write it down for with the exacerbation of asthma for urgent admission over here. This line can be written in the conclusion. Anyhow, it can also be written over here. Then, as we can see that this is a acute symptom in the last visit, so we can start with today. Let's say today, while he was close to the center, he has or he presented with crushing and sudden nature of chest pain despite administering Angini, his pain did not relieve. Right? Afterward, we can write it down beside that. His asthma has worsened since last visit. right? And we can see that. Then we can write down on, let's say, on ECG, try to write in full form, or we can also write down there was a mild ST elevation on the anterior leads was appreciated with ST 120, right? And positive S3 heart sound, right? We can also write down on lung auscultation he was having bilateral crackles along with wheeze in her. His oxygen saturation. We can also write down, sorry, this should be corrected. He was having bilateral crackles along with these, right? So his oxygen saturation was 86% on room air. So you can write it down this thing. Afterward, we can previously, like, just summarize it down. Previously, he has a long stand. He has 3 weeks history of mild chest pain with insignificant findings, including normal ECG. He, however, has ischemic heart disease on ETT, right? You can just write on this thing. Along with that, his asthma has been worsening due to non-compliance, which has been affected by alcohol dependence, right? We can write it down, and at the end we can write down, let's say, Mr. Alvin, a non-smoker, drinker, सब कुछ लिख के, then we can write down, in view of the above, we are transferring this patient, blah blah, and he has been given, let's say, GTN patch and all this thing, right? And in the end you can write down, please do not hesitate to contact me if you have any further queries. Yours sincerely, doctor, right?